This video should not be construed as dictating an exclusive course of treatment. Variations may be warranted based on patient needs or the setting in which care is provided. This video is intended to be used at the time originally presented and is not intended as medical advice. Opinions expressed in this video are those of the speaker and not necessarily of the American College of Obstetricians and Gynecologists, nor of the companies providing financial support for this video.
FEMUR is the Fetal Infant Mortality Review Program that was initiated by Dr. Ezra Davison in 1990. It is a program that allows us to look at maternal and fetal deaths, primarily fetal deaths. Sometimes there are both. And what we are involved in, particularly in Florida and around the country, is participating in the FEMUR process. This process includes, first, organizing a multidisciplinary team. That team consists of nurses, midwives, physicians, and we want you to be involved, and we are involved in our area. And this is a multidisciplinary team that looks at cases and reviews fetal and infant deaths. The meetings are usually once a month and last about an hour or so. The multidisciplinary team does case reviews in advance and prepares a very nice summary of the case reviews that are then discussed confidentially at the FEMUR meeting. All of the cases are de-identified, and most of the time you do not know who was involved in the case. The discussion revolves around not forming blame, but trying to determine why the fetus or the infant died. We are all for trying to make sure that fetuses and infants do not die. Sometimes they are preventable cases, and sometimes they are not preventable cases. The abstractors also frequently are able to talk to the mother or partner to decide how events led to the fetal or infant death. Once that meeting is held, recommendations are made by the multidisciplinary team, and those recommendations are sent on to a community action team. Depending on what state you're from, those members can be lawmakers, policymakers, Healthy Start, which we have in Florida and other areas of the country. And the community action team does exactly that, looks at the recommendations, and then makes particular action recommendations to put in place. For example, the multidisciplinary team may have recognized that the patient was not counting fetal movement, so that there are mechanisms put in place to encourage our patients to count fetal movement. Or there may be a problem with safe sleep. The baby was not put on the back, or was put on the stomach, or was sleeping with the parent. Therefore, recommendations are made that the baby should be placed on the back and not be sleeping with the parent. So this is the way that the death of the fetus or the infant can be translated into actions and recommendations by the community to help decrease fetal and infant mortality. Again, this is not a punitive process. It is a helping process, both for the provider and for the team. I'd like to encourage the fellows of our college to get involved with FEMUR. It takes an hour of your time, probably a month. Those who are leading FEMUR groups around the country need your help, need your support, and need your advice. I've been involved with FEMUR since it started in 1990 as the initiative by then President Dr. Ezra Davison. Again, it allows us to try to prevent the death of a fetus and a neonate. And the best way that we can do that is by looking at the case, not in a punitive manner, but in an educational manner to those involved, the nurses, the physicians, and most importantly, the patient. FEMUR needs your help and your expertise, and in that short period of time, an hour a month, your assistance is very much appreciated. And this is how I practice.